Hi, I'm Tom Doran, Chief Operating Officer at Highmark Inc. Welcome back to Hitting a Higher Mark. The podcast explores topics that are transforming how healthcare is delivered, used, and paid for. If you missed our last episode on social determinants of health, be sure to check it out. Today, we're sitting down with Sarah Marche, Senior Vice President of Pharmacy and Clinical Strategy at Highmark Health Plan, to talk about why integrating medical and pharmacy benefits can make such a big difference for both members and employers. Sarah, welcome. Thank you for joining us, and let's get started on today's topic.
Thank you, Tom.
First, what does it mean to integrate medical and pharmacy benefits?
So integrated medical and pharmacy benefits are when our customers have Highmark for both their medical and their pharmacy coverage. Our self-funded customers have the ability to carve out their benefits, and they have the ability to choose whether they use Highmark for pharmacy coverage or not. For those clients who choose to use Highmark, we call them integrated or carved in. And for those clients that choose to go directly to a PBM, a pharmacy benefits manager like Optum or Express Scripts or CVS, we call them non-integrated or carved out. So that's what it means to not have integrated benefits.
What are the benefits of combining medical and pharmacy for both members and employers?
Yeah, there's really several benefits that we speak about. Number one, integrated benefits will lead to cost savings. Primarily, we think about cost savings on the medical side of the business. And that is being driven by the fact that our members that are part of an integrated benefit see improved health outcomes. And we know that improved health outcomes drive lower costs. And so improved health outcomes is another benefit of integrated benefits. And then finally, for both our employer group customers as well as our members, we see just administrative simplification of the process by the fact that they have the same vendor for both their medical and pharmacy coverage.
Can you talk a little bit more about the streamlining of care that you just referenced for members and employers?
Yeah, if you think about it, you have your insurance card, or I think now people even have digital cards that don't even have cards anymore. But, when you go to the pharmacy or you go to the doctor's office, healthcare has become complicated enough. And the last thing you want to be worried about is which card do I use to get this drug or to get this medical service. So the fact that you're working with one vendor or one entity is really helping streamline the process. Or even if you're a member, figuring out who do I call? Do I call my medical insurer? Do I call this pharmacy benefit manager? And so again, that's further simplification, because there's more and more drugs that are coming out in the market these days that are actually being administered under the medical benefit. I think we typically think about drugs only being administered in the pharmacy benefit, so those drugs that you go to the pharmacy to pick up. But more and more are actually drugs that you have to get infused. And it's a little bit confusing, having to, as a member or a patient, think, where do I get this drug? So having one carrier to cover both is, streamlining the process.
I know a little while ago, we introduced a new hemophilia benefit. Could you spend a little bit of time on that?
Yeah. And this is another area that integration helps with cost savings, because as I mentioned, there are drugs that you can give in the pharmacy benefit and there's drugs in the medical. And sometimes if you drive the utilization to one particular benefit, that by itself can drive cost savings. So we implemented a program for hemophilia because hemophilia drugs were typically being given under the medical benefit. But when we looked at it further, we saw that patients were actually self-administering these drugs. So they really more appropriately fit under the pharmacy benefit, where, you take a pill, you give yourself an injection. And when we did that, when we moved the drugs from coverage under the medical to the pharmacy, it allowed us actually to negotiate better unit cost pricing, which resulted in cost savings. It allowed us to apply utilization management at the point of sale, which improved or made sure that utilization was appropriate. And it allowed us to implement a hemophilia case management program that further drive cost savings, because we were able to ensure that members, before they got that drug, did not have supply on hand, further decreasing the cost of treating hemophilia patients. So without the integrated benefits, it would have been really difficult to ensure that the drug was being given under the optimal benefit.
Yeah, I think that's a great example of where, Highmark, we're at our best, right? We do what's right for the member. We hold costs down. We provide the right side of service. I think it's a great example.
Right,
So thank you
right.
for that. Can you go into a little bit more about, when we're integrating benefits and, do we have the ability to work with vendors and other partners?
Yeah. When we go out and talk to drug manufacturers, we are able to come from a different perspective. The fact that we have the visibility into both the medical and the pharmacy. And so just like, I mentioned drugs can be given under the medical and pharmacy benefit. For us to really ensure that we're treating a disease appropriately, we really need to have a full view of that patient and full view of the different drug options under each benefit. So when we go to manufacturers, the fact that we have that full view and we have data across both sides allows us to work with them differently. So we are able to actually see, are the drugs performing in the real world as they're intended to? So we take the pharmacy claims data, we marry it up with the medical data, which shows clinical outcomes, and we're able to say to a manufacturer, yes, this drug performed as it was supposed to, or no, it didn't. So we've got some contracts with manufacturers where we say, if this drug did not perform as it was supposed to, let's say it's supposed to prevent hospitalizations and the patients were hospitalized more than expected, then we would ask for payment back from the manufacturer. Another way that we can work with manufacturers differently is through the ability to see total cost of care. So without the ability to look at both the medical and the pharmacy benefits integrated, we can't measure total cost of care as easily. And a lot of the times, even though we see drug costs increasing, we're able to show that along with the drug costs increasing, we're seeing a lower total cost of care to treat that disease. And manufacturers see that as extremely valuable to both see that whole picture.
Thanks, Sarah. We've talked a lot about cost, but can I just ask you, as a medical professional, can you, explain the health benefits of combining the points of care?
Yeah. So, again, many more and more diseases are primarily being treated with drug therapy. And those drugs are crossing both medical and pharmacy. So imagine being a nurse or even a pharmacist, case manager, and you're engaging with a member or a patient, but you can only see one side of the equation. You only see those services that they've received on the medical side. You're missing a huge part of the treatment of that disease. So how can we appropriately engage those patients, manage those patients' care without seeing that whole picture? The other thing, if you think about drugs are often the first indication that a patient has a new diagnosis. So maybe they get started on a diabetic medication or a medication to lower their cholesterol or lower their blood pressure. They might not have a hospital claim, but sometimes that first indication is that a nurse or pharmacist case manager sees a prescription drug claim, and that gives them a clue that the patient has a new diagnosis that needs to be managed. So it allows us to in a more timely way, reach out to patients, identify gaps in care, identify duplicate therapy. That's another, potential that we see. And that, again, by having a more robust data set across both the medical and pharmacy, we're just better able to coordinate that patient's care and manage that patient's disease condition.
Thanks for that. Can you talk about some of the results we've seen with integration?
Yeah. And this is actually probably what's most exciting for us is that, we've done, I think, about 3 studies in the past to prove the benefits of integration. The first one, I think, was going on 5 years ago or maybe 6 years ago, where we compared the medical costs of our members that were part of an integrated benefit compared to the medical costs of the members that were part of an employer group that had carved out their pharmacy benefits. And the first 2 studies that we conducted internally within my team and within our analytics organization. And we're able to demonstrate that members or groups that were part of an integrated benefit saved money on their medical care costs. But we received a lot of pushback in the market. The market said, well, of course, you're going to come up with benefits or positive results. You conducted the study yourself. And so we, this past year, actually hired an outside consultant. We worked with an organization called Healthscape And we asked them to come in and help us here. So they did two things. Number one, they validated our previous studies and looked at the methodology. And then secondly, they reconducted the study with more frequent or more recent data. And what we showed, once again, for third time in a row, thank goodness, we were able to prove that, our employer groups that were part of an integrated benefit saved on medical costs. And we saw that they saved anywhere from $150 to $230 per member per year. And that's significant. So, even though these groups are seeing a rise or a rate of an increase in prescription drug costs, when they're part of an integrated benefit, driving lower or improved health outcomes, we're driving lower medical costs. So we're really excited about the results there.
Yeah, definitely. It's a great outcome and really tangible, meaningful benefits for folks.
Mm-hmm. Right.
Can you spend a minute talking about, what it means from a member perspective, the member experience from an integrated medical and pharmacy benefit?
Yeah. So as I mentioned before, healthcare has become just way too complicated and overcomplicated. And that's one of the things that Highmark, I'd say in general, is trying to address as an organization, is trying to simplify healthcare to minimize or eliminate, if possible, stress related to just, sometimes getting your healthcare services. And when you have, when you've got medical and pharmacy coverage, which are really foundational and core to health. You've got your medical services, you got to be able to go to the doctor, you got to go to the hospital, and you've got your pharmacy coverage. You want to be able to go to your local pharmacy and pick up your prescription or get your prescription through mail order. And as I mentioned, when you have two cards, it can get extremely confusing on which card do I use for which service, which one's the optimal service card to use, because sometimes both cards will work. Which one will drive the cost savings? Who do I call when I have a problem? So that's one way we see it. But more importantly, from the clinical side is, because we integrate our benefits and we think about it from a holistic approach, when we have drugs that treat one disease and those drugs span both benefits, we can make sure that the strategy to cover those drugs or the prior authorization criteria or the formulary status across both benefits are aligned. Because the last thing we want to happen is that a member that is not part of an integrated benefit, they go to their PBM to get a drug and they find out that the PBM excludes that drug. And then they go to their health plan carrier and they find out that the health plan actually excludes it under medical. So both of their insurance carriers exclude the drug. Well, what does that patient do? They're really stuck in the middle. So with us, we're able to make sure that we're aligning the coverage strategy so that the patient really never gets stuck in the middle.
Very cool. Very cool. Yeah. So Sarah, I know Highmark and your team specifically has been very innovative in the pharmacy space. And recently, there was an announcement about Highmark and 4 other Blue Cross Blue Shield plans coming together to work on a new pharmacy venture called Evio. Can you tell us some more about this?
Yeah. So, I would say part of the pharmacy strategy at Highmark has always been to be innovative and to think about the development of solutions that are going to, again, lower cost and improve health outcomes for our members, and just continue to make Highmark more competitive in our market. Because, drug spend is now about 30% of overall healthcare spend. So it's really important that we've got a good handle on how do we manage that spend in order to ensure that we remain competitive in our market. So a couple of years ago, Highmark got together with 4 other Blues. And that was Blue Cross Blue Shield of Michigan, Massachusetts, California, and Independence Blue Cross in Philadelphia. And we said, what can we do together that will actually help address some of the health industry challenges that we're facing? And while we explored several options, but pharmacy really rose to the top as really an area that had a lot of issues. We're seeing a lot of increased costs. And we really felt like we could make an impact and we could make a difference. So these 5 plans came together and formed a new company called Evio Pharmacy Solutions. And we will be challenging Evio, just like any partner or any vendor that we work with. We're going to challenge Evio to develop solutions that we can then take and deploy into our own respective markets to help us be more competitive, improve the patient experience, improve the provider experience, ultimately helping to lower the cost of healthcare and to improve health outcomes for our members. But yeah, they'll be creating solutions. Our goal is to better leverage all of the data that we have in order to gain more insights that will help us, drive more impactful solutions for our members.
Thank you very much, Sarah, for the conversation and the time. And I'd like to thank everybody for joining us and learning more about the benefits of integrating medical and pharmacy care. And again, I'm Tom Doran, and thanks for listening to Hitting a Higher Mark.